So you're thinking about becoming a pharmacist. Well, let me tell you a little bit about my journey and my current job and see if this is something you're interested in. So I actually started out as a cashier at Walgreens. I was up at the front and I would, occasionally walk back there and I was like, that's kind of cool. The pharmacy looks pretty cool. So I went back there, eventually got a job as a cashier back there. They trained me to become a technician, a pharmacy technician. I was a pharmacy technician while I was doing my undergrad. And then when I went into pharmacy school, I became a pharmacy intern, still in the retail space. And once I graduated pharmacy school, I became a pharmacist for Walmart. This was a cool experience. It's probably what everyone thinks about when they think of a pharmacist, retail pharmacy. So I did this for a while and I did enjoy it. It was stressful at times, but I enjoyed interacting with the patients. But I wanted to try something different. So I got a job at a children's hospital. And this is completely different. One day you might be just mixing up IVs in the IV room or you're verifying orders. The only thing is you're not really interacting with patients because you're in the pharmacy inside the hospital. So all that leads me to where I'm at now, which is a long-term care consultant pharmacist. And that's pretty much a pharmacist for long-term care facilities like nursing homes and assisted livings. And it's completely different than hospital and retail. Most people probably haven't even heard of it. So I don't fill medications, I actually do medication regimen reviews. I go through each resident's list of medications. I check for interactions, if they're on the right doses, if they're on duplicate medications. Then I work with doctors and nurses to recommend changes so patients stay safe and they get the best care possible. That's kind of the main things that I do. There's a lot more to it, obviously, but that's going to be for another video. So for you or for anyone else that's looking to become a pharmacist, my recommendation is to go job shadow a pharmacist. I would go find a retail pharmacist, go job shadow them for a week, then go find a hospital pharmacist and go job shadow them for a week, and then a consultant pharmacist and maybe a nuclear pharmacist. Just ask around. I don't see a pharmacist out there that would say no. But if you do have any questions, feel free to drop them in the comments. And if you want me to talk about a specific job in more detail, then just let me know in the comments as well.